Hi, welcome to MedTalk by Medical Tourism. Join me as I talk to patients who have used our website to get in touch with doctors. We will hear about their procedures, their experience, and a couple of tips they offer us about medical tourism. Let us begin. Hi, thank you so much for joining us. This is going to be one of our episodes where we get to talk to an ex-patient who has used the whole medical tourism experience and is going to talk about it a little bit, tell us a little bit about her experience. And right now I'm speaking with Sarah. How do you pronounce your last name?
Zink.
Oh, okay, cool. Can you tell us a little bit about why did you decided to travel to do the surgery and what surgery did you get?
Sure. Thank you for having me on your show. I'm 62 and I had begun to notice I had skin that was drooping down over my eyelashes. So that's what really started the whole process. And I did research, lots of research, and I did use your website. So that was very helpful. I found a doctor in Panama City. His name's Dr. Luis Picard Ami, and he is fabulous, but I can talk about that in a minute. And I visited with him, and there was another thing that came up. So the long story is I've lost 140 pounds.
What?
And so, yeah. And so I had a tummy tuck in 2017 in the United States. And then I had my breast lifted and an implant in 2018. But the one thing that always drove me crazy was I had this big double chin.
Okay.
And it felt like, it's a consequence. I understand it was a consequence of weighing 315 pounds for, 20 years. But man, I hated that thing. So when I met with Dr. Ami, I asked him about the eyes, but then I asked him about the chin. And what I loved about him is he said, okay, well, here's what we can do for your eyes, and we can do this thing for your chin, but I just want you to know what to expect. And he laid out reasonable expectations. And he made it clear that if they didn't do anything about the middle section, that it was going to look a little strange because I had some big wrinkles here. I had some other issues, but he was zero pressure. He said, listen, it'll still look fine, but it will be different than if you have the whole thing, right?
Of course, unless we were in COVID and you were using like the mask still. Yeah, because this part would be like 30 years and then the rest of the face like 6 years. Yeah, damn COVID.
Exactly. We actually made that joke that if we were all still wearing masks, the middle section wouldn't matter. We talked about it, and I asked him to give me, again, the thing I love about him is he's like, you tell me what you want to do. And here are the reasonable expectations for, if you do just this, if you do just these two. He laid it all out. And then I just decided to have a complete facelift. So they did the upper eyes, the lower eyes, the middle section where they filled this in, and they actually, I can show you the scars. It's only been 3.5 weeks.
Wow.
Yeah.
You look amazing.
Thank you. I'm still swollen, so it'll be interesting to see what it looks like when the swelling goes down.
Wow.
So we got the eyelids, this section, and then, for lack of a better word, they took my double chin off.
Okay.
He also did fat injections, which it's just completely changed my face in a very positive way.
Okay, that's like amazing. And what made you choose Dr. Picard?
It's interesting. I had made a list of 8 doctors that I was interested in, and I emailed them all. I had one answer, and then he was kind of squirrely, was not a good communicator. And my theory, Kurt, is it doesn't get better than the first date. And so if he's not communicating with me well when I'm not a patient yet, it's not going to get better after. So I narrowed it down to Dr. Ami. I had emailed him on a Thursday night, and Friday morning, I had an answer from him. And Friday afternoon, I had one of his office people had already set up an appointment for the following week. And I also had another interview with a guy in Colombia. And actually, they both were really good. I was very pleased. But Dr. Ami has a way respecting what you want. He's not trying to talk you into anything. He asks you what your outcomes. What are you wanting out of this? I really like that. Now, for me, it's less medical tourism because I'm in Panama, but I wanted to go to Panama City because there is a facility there called the Panama Clinic, and that's where Dr. Ami works. And it is a complex where the clinic is in one section of the complex, and then there's a hotel right there. And then the doctor's offices are right there. So you're all in this really tight area. You're not traveling all over, the city to get from one place to another. So I chose him because he really respected what outcomes I was after. I'm sure pricing differs for everybody depending on who you are, what you need, what all he's going to do. The pricing was amazing, particularly compared to the U.S. best. His office staff is super professional. One of the things that probably concerns English speakers about traveling, particularly to Spanish-speaking countries, is, oh my gosh, I don't speak Spanish. Well, the first thing I learned was, lo siento, mi español es malo, which means, I'm sorry, my Spanish is bad. And I will tell you, if you start out, letting people know that you're trying, his office, there are several people in his office who speak English. His English is great. And so that mattered a little because I wanted to be sure I could communicate not just what I wanted or needed, but if I had a problem, like if I was in pain or if something didn't look or feel right. So it was just all these reassurances that he cared about the outcomes. He had people who could communicate with me, very responsive. His office is well organized. I'm super glad I picked him. On top of the fact that he is American board certified, he's board certified in Panama. He's the head of the Panama Board of Plastic Surgeons. And I mean, he's just well educated and well respected in his field. So all of those things made it, I don't want to say impossible not to choose him, but I think it would have been foolish for me not to.
That sounds good. That for you, it was the best option.
Yes.
Where are you originally from?
Texas, actually, right in between Dallas and Fort Worth. So we've been here about 2 years.
Cool.
But I would have definitely traveled. And I've actually referred him to some of my friends in the U.S. because, Panama City is only a 2-hour flight from Miami.
Of course.
So it's not like, it's
it's not a big deal. And just for the record, on our website, we do say that our doctors, we only work with several doctors. We don't work with every doctor. The doctors that we found, they speak English. So for the people who hear us, that shouldn't be a concern. If you choose to look up at a doctor in our website. How long was your hospital stay and your recovery? How was the process? Was the doctor present? How do you feel about that?
Yeah. So again, everybody's choices. I've talked to a couple people who used him and everybody makes different choices. I chose to stay in the hotel on the property. Another person who used him stayed off site. We both had good experiences, but my procedure was on a Monday. It was 5.5 hours. And then he wants you to stay overnight in the hospital.
Of course.
It's interesting. I was hoping you would say, of course, because in the United States, they will send you home that day.
What?
Oh, hell yes. When I had my tummy tuck, I went home that day. And so it's an added expense, but I will say that I like the fact that they want to make sure everything's okay. I mean, I had those little compression things on your legs all night after my surgery. But again, I know every doctor does things different. But so I stayed in the night in the hospital. The next morning, he sent one of his nurses to help me because I have long hair. I mean, it's small. And when they do face procedures, they wash you so much. And all that was in my hair. He sent a nurse the next day to help me wash my hair, get all my incisions all cleaned up, changed my dressings. And I mean, she was the bomb. Her name's Yolanda. And I mean, she's the bomb. She helped me shower. She helped me get everything all cleaned up. She broke like 7 little teeth on the comb trying to get my hair all straightened out. The added touch of him sending a nurse from his office who's familiar with plastic surgery was a big deal. I actually had her come to my hotel room the next 2 days just to help me make sure I was cleaning everything right and putting on, the bandages correctly. So there's a sense of compassionate care. I'm not going to say that you won't get it in the United States, but when you're traveling to a foreign country to have a procedure done, and I traveled alone, which is another difference in how other people do things. It was compassionate care that it meant a lot.
And usually, for example, your dollars have more value. So you're paying for, like, money-wise, you're not spending a lot of money, but you're getting, like, the best doctors in the best hospitals and the best medic. So you're like VIP patient. I mean, because you have more acquisition power, I'm guessing. I don't know.
Yeah, and let me say, I'm going to share how much, in a general way, how much I spent. It was about $16,000. But listen, here's what I got for all that. It was 2 weeks in the hotel. It was the doctor fee. It was the anesthesiologist. It was the overnight stay in the hospital with all the meds. It was 5, lymphatic therapy sessions, all my food, all my supplies, my medications, and my flight from David to Panama City. So for $16,000, it was all that.
It was all that. And you were catered like a princess.
And in the United States, $16,000 would have been what I paid the surgeon. So, I mean, yes, my money went twice as far. And I was treated, and it wasn't even like a diva treatment. It was just respect. It was just compassion. It's what you want to get out of healthcare.
Yeah, feel comfortable. That's very important. If you're traveling for medical tourism and need accommodation, transportation, or a guided tour, visit the service section on our website, where you will find the best options we found for you. Follow the link on the description and start planning your medical trip today. What do you feel when you met the doctor for the first time?
So it was interesting. We did a video consultation, which was another thing I really liked, was he doesn't make you come to the office. You still have to have a pre-op appointment. But when I met him in person, he has a really good energy. I'm not all, I'm kind of woo-woo, but when you meet people, you get a feel for them. And you can feel if they're good energy or bad energy. And he really had a good energy about him. And again, he's so, I don't want to say blunt, but he does not play. He will tell you if your expectations are realistic or not. And that made me feel good. This result, I hope you are able in some way to show those before and after pictures. My double chin being gone is far beyond what I could have expected. I mean, I'm just so happy about that,
And you look great. And if you wouldn't tell me your age, I would have not noticed. It's like,
I don't know. I can't get my chin up too far, but you can even still see the scar. It's only 3.5 weeks.
Wow. Okay.
And I credit the healing to staying in the hotel room. All I did was eat and sleep. And I'm not kidding. I ate a lot of good, healthy, like protein and, good food. And then I would sleep. And that's important, I think, the rest and the good nutrition. But they did these therapy things, Kurt, like, I don't want to call it
massage. Yeah.
Yeah, lymphatic massage, but they also had a machine that they went over the incisions with. It was like a sonogram kind of thing. I don't understand it, but big difference. But then they had a little machine that did some sort of sonogram
healing?
Kind of healing. I don't know. I wish I knew, but it sure did work.
You liked it. Cool. If you don't mind me asking,
I will tell you.
How much did you spend in your surgery, on your bariatric surgery in the United States?
So when you say bariatric, are you talking about the tummy tuck or the breast lift?
Yeah.
Or, the tummy, I want to say the tummy tuck, well, it sucks to get old because I'm trying to remember. I want to say that the tummy tuck and the breast lift were together, and it was just for the doctor. I want to say together they were like $20,000. So, and that was, now remember, the tummy tuck they took off 7 pounds of skin. It was not just a tummy tuck, but they did the tummy tuck and the breast augmentation were about a year apart. But I think between the two, one was $12,000 and one was $8,000. So, I mean, the price difference between the United States.
And the overall pricing, how much was that in the United States? How much did you spend with the whole?
Oh, it was $20,000 for both. I went home. I didn't have a hotel. Sent home after both surgeries, so I didn't have a hotel. And the surgery was in our town. So, I mean, that was literally just the doctor.
No, I got that, but I meant like for medicine, supplies, stuff like that. Did you need like assistance?
Yeah, my husband had retired, so he took care of me. So I did not need nursing. The medicine, we had, I'm going to say, just a few $100s. But I mean, God, when you're spending $12,000 on a tummy tuck, $200 for prescriptions just doesn't even register, right?
Yeah, doesn't even compute. Yeah. And did you feel after your surgery that the doctor give you a good follow-up? How was that?
Oh my God, yes. I had to go in. Actually, I had to go in the day after. So my surgery was on Monday. I went back to the hotel Tuesday. And I want to say it was Tuesday afternoon, he asked me to come to the office, or Wednesday, because he said that the nurse had seen something over here on my neck that she didn't like. And so I went in to see him so he could look at it, and it was fine. Then I was going in for these massage therapies. So he saw me like every couple days. I want to say, though, here's an interesting thing. There's a lot. I did a ton of research. Research is my thing. And so there were some things that I did not expect that I think people need to be aware of. And it doesn't matter if you go to Colombia, Mexico, Panama, or in the U.S. When you get a facelift like this, your vision's going to be blurry for a couple weeks afterwards. And I knew it was going to be a little blurry, but it was really blurry. But that's normal, right? But then there's also this strip from, you can see where these incisions are. They cut right here and they cut right in front of my ear. Okay, so it's numb from here.
You're healing like amazing. I to be honest, I don't know. Leave us a comment if you see the scars because I don't see it. And
I'm not a paid actress, I swear, and I don't wear makeup. So the only thing I have on is lipstick and mascara. So
That's just bragging.
I'm not trying to hide anything. I bet. Oh wait, hang on. I bet I can show you. Hang on. Can you see his scar now?
I can't. I'm sorry. It's not even red.
Oh my gosh. Okay, well, I'll tell you what I think that's from. They give you these little scar treatments. Well, they don't give them to you. You have to buy them. After the first week, you're just using, I think it's an antibiotic. The second week, you use it's a scar cream. Then you buy another one that you take home with you. So it's really, I'm sure it's a combination of healthy eating, lots and lots and lots and lots of rest, the massage therapies, and the scar creams. I wasn't about to spend this money and do anything wrong.
Of course. But yeah, right? It looks amazing, to be honest.
Now, I have to tell you something else that I didn't tell you earlier. We discovered in the course of meeting with Dr. Ami, I talked to him about some other procedures I was interested in having done in 18 months after I healed from this and saved up some more money or whatever. We just found out about a week and a half ago that the breast implants I got in 2018 were recalled in 2015. My plastic surgeon in the U.S. didn't tell me. So I'm going back to see Dr. Ami in 5 weeks to get them replaced. So I'm going back to him for a second procedure, like 8 weeks. It's not even going to be 8 weeks from this. I have to go back and get this other procedure. So we'll even have more to talk about.
Yeah. I'm going to try to save your contact. And do you have any tips or suggestions for people who are thinking about doing medical tourism, people who are thinking of traveling? Do you have any recommendations, tips, suggestions, anything?
I do. I have an opinion about everything, right? I picked Panama City because I'm in Panama, and I was familiar with Panama City. But there are plenty of other places that may serve your needs better. Before you enter into any decision about medical tourism, I think you have to decide what's important to you, okay? Cost is just one small factor. I traveled alone, so it was a big deal that I was in familiar territory, and Panama City's familiar to me. For you, if you have someone traveling with you, you may be comfortable going to Mexico or Colombia, someplace you've never been, because you have someone with you. I think you also have to decide how much English do you need your doctor to speak if you are not bilingual. Okay, your doctor may speak some English, but does his staff speak English? You need to know that. One of the deal breakers, Kurt, when I was interviewing the Colombian doctor, was that they have a disclaimer that you really should have someone travel with you who speaks Spanish, because when you wake up from your surgery, there won't be anybody there who can speak English. And that kind of bothered me. I mean, I know how to say dolor, which is pain, but I don't know how to communicate lots of more than that. And so that made me anxious, thinking, okay, if I wake up and I have a problem and nobody speaks English, okay, so you have to decide what your comfort level is and whether you're going to travel alone or with someone. So it isn't just about the money. You have to know what your tolerance for being in a different environment is. That's probably the biggest thing.
Of course. And again, not to sound like a commercial, but if you check out our website, our doctors are familiar with this experience, and they're like medical tourism doctors are familiar with international patients. So they have experience with that, and they anticipate a lot of your needs.
Yeah. And your website was actually one of the ones I used. So
if you speak English, so it's going to be okay. If you choose one of the doctors that we research for, right?
Well, with the translator apps that they have now, honestly, all the nurses in the Panama clinic had the app. If we couldn't communicate with my bad Spanish and their bad English, we used the app. So it's 2024. We have ways of overcoming some communication.
Cool. I'm glad to hear that. Thank you so much. Is there anything you would like to add?
No, just thank you for letting me share my experience. And if anybody has any questions, I'm sure they can let you know, and you'll take care of them.
Thank you so much, and thank you for that line. If you have any questions, please leave us in the comments, and I make sure we follow up on them.
Okay, my pleasure. Thank you. Bye for now.
Thank you so much, Sarah. Antes de escoger a tu doctor, investiga sus años de experiencia, así como el número de procedimientos que ha realizado y si es miembro de las instituciones que regulan y certifican que cuenta con los estudios y conocimientos necesarios para realizar los procedimientos y cirugías que ofrece. En la descripción encontrarás un enlace con más información sobre el tema hablado, así como los especialistas dentro de la República Mexicana que cumplen con los requerimientos para hacerlo. La información mencionada aquí representa un punto de vista y no debe ser tomada como una valoración médica. Y recuerda, invertir en salud para no gastar en enfermedad es una excelente filosofía, Gracias por escuchar y no olvides suscribirte a nuestros canales.